Welcome everyone to the module Neuropsychiatric Syndrome. In this module and throughout this caregiver series, the term persons living with dementia will be used to emphasize that dementia is a diagnosis and does not define an individual. Dementia is a highly stigmatized disease process. The term person living with dementia is used to promote positive language and a more person-centered approach. This is presented by GAPNA and the Geropsychiatric Nursing Special Interest Group. So, we know if you are a caregiver for a loved one with dementia, you may already be aware that dementia is more than memory loss. But what is the difference between normal aging, symptoms of dementia, mental health diagnoses, or physical illness? That's what we want to share with you today. So I will discuss the definition and how to recognize neuropsychiatric symptoms that are associated with dementia. First of all, it is important to know the difference between neuropsychiatric signs, symptoms, conditions, syndromes, and disorders. A lot of words we're going to be talking about today. We are all aging. Normal age-related changes are not diseases and are not signs, symptoms, or syndromes of a mental health disorder. Although there are age-related changes in memory, such as how long it takes us to remember something and learning new things. But these are not symptoms of dementia or a mental health condition. This is very important to remember. So, what are signs and symptoms of dementia? A sign is a manifestation of something that's going on in somebody's body. It's a condition. Signs are observed by caregivers like yourselves or someone else rather than reported by the person who has dementia. One example of a sign of Alzheimer's dementia is memory loss. Typically, signs of a disease such as Alzheimer's may be mild and then progress to what we call moderate, and then eventually at the end of the disease process, severe. It's also important to remember that there are age-related changes in memory, such as forgetting someone's name, but later on remembering that name, or misplacing an item, but finding it later. It is the frequency and the disruption in our activities of daily living that determine a disease process such as dementia that requires treatment by a healthcare professional. Symptoms, on the other hand, are reported by the person living with dementia rather than being observed by the caregiver. An example of a symptom of dementia is if a person were to say something such as, "Last night, there were 3 robots in my house trying to steal my purse." The Alzheimer's Association, which has very good information for caregivers, has published the 10 early warning signs and symptoms of dementia. I want to go over those real quick. Number 1, memory loss that disrupts daily life. Changes in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual or spatial relationships, new problems with words, whether that's speaking or in writing, misplacing things and then losing the ability to retrace steps to try to find something, decreased or poor judgment, withdrawal from work or school activities, and changes in mood or personality. So there are also conditions, we're called subdromal, meaning below, and they're kind of in between or below a specified level or threshold that healthcare professionals are looking for to qualify as a diagnosis of a specific condition. Subdromal conditions, remember those are below, are medical conditions that do not meet full criteria for a diagnosis, say of dementia. The cluster of symptoms are fewer or less severe than the defined syndrome, but that nevertheless can be identified and can be related to the full-blown syndrome. An example of this condition might include an individual who admits that she frequently forgets to pay bills, but she can remember to pay them if she writes the deadlines on a calendar. She may also report that she cannot remember where she places her cell phone and keys. But if getting a larger purse with a special pocket for the cell phone and a special pocket for the keys helps her to keep track of personal items, then that's okay because they have learned to cope with that. What we call that is an example of mild cognitive impairment, which as we age, sometimes that occurs with all of our memories. So then a syndrome is a grouping of signs and symptoms together based on how often they occur and may suggest that something is going on in the person's life that we need to take them to a healthcare professional for an assessment. So what are neuropsychiatric symptoms in association with dementia? What this whole series is about? Well, neuropsychiatric syndromes are clusters of symptoms. They are specific to the disorder. So we're talking about dementia here. For example, dementia has depression and psychosis, and that is specific to Parkinson's dementia that comes from having Parkinson's. Researchers sometimes use the term agitation along with apathy and depression to cluster symptoms that are included in the neuropsychiatric syndrome, especially for Alzheimer's dementia. So it's important to remember, especially as caregivers, the different signs and symptoms and the neuropsychiatric syndromes. So that helps not only a healthcare professional in diagnosing, but then doing the right treatment options that are available. We really want you to remember too that dementia is not a normal part of aging. Dementia subtypes such as Alzheimer's or vascular dementia are really neurocognitive disorders. So something with the neurology system or the nerves in our brain are not firing or functioning in the way that they normally do. A mental disorder is a syndrome characterized by clinically significant disturbance in a person's cognition or the way they think, how they're able to regulate their emotions, or some behavior that reflects an actual dysfunction, either in the psychological, biological, or developmental processes underlying how we think and how we feel and function mentally. Alzheimer's dementia is an example of a major neurocognitive disorder. So what are the neuropsychiatric symptoms of dementia? There are varying terms such as behavioral and psychological symptoms of dementia, agitation or aggression, and they have been characterized as behavioral or psychological in the past. So that was before 1999. Now, behavioral and psychological symptoms of dementia, or BPSD, is defined as symptoms of disturbed perception, thought contact, mood, or behavior that frequently occur in individuals with dementia. So some more terminology that is important for you to understand. So physical aggression, wandering, restlessness, and agitation are examples of the behavioral symptoms. Anxiety, depression, hallucinations, and psychosis are examples of psychological symptoms. So the terms agitation and aggression are often used interchangeably. There are verbal and physical symptoms. The overlap between agitation and aggression has been recognized by researchers and professional organizations. So agitation is often defined as an unpleasant state of excitement experienced by the individual with dementia of the Alzheimer's type. So these symptoms are being observed as patient behaviors, and they are able to be seen by caregivers such as yourself or others, and they keep experiencing these unpleasant states of excitement, and sometimes it's reaction to internal or external stimuli. And so how do we treat these things? And agitation has more recently been defined as occurring in patients with a cognitive impairment or dementia symptom, and then exhibiting behavior consistent with emotional stress, although maybe they can't tell us verbally about that, manifesting excessive motor activity, verbal aggression, or physical aggression, and then evidencing behaviors that cause excess disability and are not solely attributable to another disorder. Alrighty, so let's talk a little bit about stigmas. Terms such as agitation and aggression and associated behaviors have a connotation that the person's doing them on purpose. And when in fact, these expressions are a symptom of a disease process, similar to having an elevated blood pressure or a high blood sugar. Standard terms and measurement tools are important because dementia is already stigmatized itself. When we use some of these other words, such as agitation and aggression, it makes a negative connotation for that individual with dementia when they have no control over what their body and their mind is engaging in. So we now think about changing the terms of dementia to neurocognitive disorder, but we're still using the word dementia because that's what people are familiar with. But we also are trying to make comments about rather a person diagnosed or a patient with dementia. It's a person living with dementia. And this is what we're trying to change a little bit. So as a caregiver, how do you recognize neuropsychiatric syndromes? Although informal caregivers are not paid healthcare providers or professionals, you are the expert on your loved one and a very important contributor to your loved one's care. Symptom clusters may vary depending on the type of dementia. Apathy and depression may be a common neuropsychiatric syndrome in Alzheimer's dementia. In general, if a person is having delusions, they're common in the early course of the disease process of Alzheimer's dementia. And hallucinations may actually occur later in the course of the disease. Hallucinations are also common in Parkinson's-induced dementia. However, hallucinations and delusions may also indicate urinary tract infections, pneumonia, or other disease processes or things that are going on in the person over and above their diagnosis of dementia. So what we ask of you is anytime there are any new symptoms, they should be reported to the healthcare provider to determine if a treatment for infection is required or whether the symptoms are a progression of the disease of dementia. So bottom line, neuropsychiatric symptoms occur in almost all persons living with dementia eventually. Recognizing the symptom clusters and neuropsychiatric syndromes are associated with the neurodegenerative disorders provides us with information as healthcare professionals, gives you information so we can all use a systematic approach to treatment. Standardized definitions and person-centered terms are needed to have a high level of care for persons living with dementia. Caregivers are members, integral members of the interprofessional team, and experts more than the healthcare professionals on their loved ones who play a significant role in the care of persons living with dementia. Caregivers who want to know more about neuropsychiatric symptoms and syndromes of dementia are encouraged to participate in our series. So thank you very much for participating today in the introduction to neuropsychiatric syndromes. Thank you.